Okay, let's get started again. Thank you all for your participation so far. This afternoon, then, we have basically 3 sessions. This next session, session 3, looks at which approaches can help to anticipate and prevent nutrition crisis. So we'll be doing some sharing and discussing learning from ERNE on tools and approaches used to prepare for, anticipate and respond to shocks, such as early warning systems and CMAM surge. And I will hand over to 2 of my colleagues to do that. After that, we will have a panel discussion about how we can further strengthen emergency health and nutrition responses in fragile contexts. And I will wrap it up at the very end at about 3:45. So to facilitate the next session, I'm going to hand over to 2 of our ERNE colleagues. Jacqueline Fries is our early warning and early action advisor on the ERNE program. And Lucy Lafferty is our health and nutrition surge manager on the ERNE program. So over to you, Lucy and Jackie.
Great, thanks, Conal. So the session that we're going to start with now is what approaches can help anticipate and prevent nutrition crises. And as Conal mentioned, my name is Lucy and I'm the Health and Nutrition Surge Manager on the ERNE PCU. And for this session, I will be joined by 5 of my colleagues who are now going to present themselves in order of presentation. And then we will run through the session. So over to you, Jackie.
Hi, everyone. So as said by Conal, I'm Jacqueline Fries, and I'm the Early Warning, Early Action Advisor on the ERNE program.
Who are you passing the baton to, Jackie?
Is Satu. We're hoping you'll present yourself to the group if you're there.
Yeah, I'm here. Satu is my name. I work as an ERNE program manager based in South Sudan, United States. Thank you.
Hi all. This is Alamayo Leveta. I am cash market and early warning early action advisor for Concern Ethiopia. Thank you.
Hello, everyone. I'm Julia, ERNE program coordinator based in Niger.
Good afternoon, everyone. I'm Alex. I'm the M&E advisor for ERNE.
Great. So that's the team who will be with us for this session. So over the next hour, we are going to be first looking at the approaches that were used within the ERNE program. We will then share some practical learning from implementation, focusing on the importance of information and coordination. And this will be explained through country examples from South Sudan, Ethiopia, and Niger with our colleagues who are joining us. During the presentations, please feel free to put any questions in the chat box in French or in English, and we hope to have some time at the end to answer those. So first, you would have seen this image this morning in the session presented by Aoife, and to situate it within the ERNE program, we're now going to be looking at a little bit more detail at Pillar 2, which was focused on preparedness and local capacity to respond. Within this pillar of the program, we had health facilities which were supported to implement the CMAM surge approach, with a subset of them focusing on a more holistic approach, the health surge model, applying the same 8 steps to help manage peaks in other child illnesses. Within this pillar, we also supported with the setup of early warning systems based on multi-hazard risks, which were established to respond to food security shocks. And so both these approaches focus on building knowledge of the local context to help anticipate and respond to shocks. So just a quick reminder, so Kate mentioned this in her session earlier, the surge approach is an 8-step process which builds health facilities capacity using local data and resources to better anticipate, plan for and respond to peaks in child illnesses, which include malnutrition. While an early warning system is an integrated system of hazard monitoring, forecasting and prediction that enables timely action to reduce disaster risks in advance of hazardous events. So some of you may already be familiar with the infographic on the left-hand side of our screen, which is an outline of the surge approach, which, as I was saying, really helps health workers to understand their catchment area and capacity, then set thresholds, and then define a surge action plan, which can be triggered if a threshold is crossed. we decided to mirror the ERNE early warning, early action component on the 3 key stages of the surge approach. So you can see this in the graphic on your screen. First, looking at the setting up and preparing for a shock. So through this, identifying indicators, ensuring cash preparedness, and formalizing a response plan. Then monitoring the predefined indicators and acting or responding to shocks with multi-purpose cash when these trigger points or thresholds were crossed. And finally, reflecting, documenting, and learning. And some of this learning will be presented in the session today. During the program, we really looked to see how these 2 mechanisms could perhaps better talk to each other, identifying areas of potential synergies. And there is a learning paper which will be shared after the event, which will explore this in a little bit more detail. So before going into the learning that we have gathered from the program, we felt it was important to reflect on some of the key contextual changes that have happened over the lifespan of the project. And some of these were touched upon earlier in Aoife's presentation and by Nigel in the introduction. And so we did a simple reflection on some key events that were happening over the timeline of the project. And overall, we felt it was clear that there was a deterioration in the context over the 3 years. We saw that 3 of the 5 operational countries reached IPC 3 or greater, thinking back to the Horn of Africa drought and the unprecedented flooding, which we saw in South Sudan. As we are seeing currently, displacement of populations really continues to be a challenge and is increasing due to conflict, notably in Sudan and Ethiopia with the Tigray crisis. And we saw a rise in inflation, particularly in South Sudan and Ethiopia. And these were some of the common challenges that we equally saw coming out of the group work. These factors impacted the operational environment and implementation of the program, while also highlighting to us the importance and relevance of local context analysis and establishing local contingency plans. So I will pass over now to Jackie, who will start sharing some of the learning.
Thank you, Lucy, for introducing us and bringing us back to the real context. So working across those 5 countries, there are aspects of preparedness that we've learned from. So what we'd like to do now is focus on that. We've really been learning by doing. We can't claim that the project design gave us all the answers. And we've been particularly learning over the last 18 months, where the first 2 countries that were running with the preparedness angles, especially Ethiopia and Niger, we started rolling it out into the other 3 ERNE countries, the DRC, South Sudan, and Sudan. And access to our country teams, more visits from head office and working together means that some of this learning that people were doing at field level was started to filter upwards. So if you look at these photos, the context of those health facilities that have been that work well or suddenly don't work well because access is limited due to the various things that have already been listed. This is familiar ground for most of you. This is where you're delivering services, especially our prestigious Ministry of Health actors that are online today. This is your day-to-day work. The third photo shows you what it's like to set up something new, like the early warning system setup. While some countries have national early warning systems, we found that in Sudan and South Sudan, we were trying to set them up at community level from scratch. And that literally means getting people from different line ministries and different communities in the same room at the same time. So there are many factors that influence the capacity to respond and to be better prepared. So we're going to look at some of them in more detail now. Let me start by summarizing what we mean by when I say building capacity. How do we build capacity? We've conceived this diagram with these 3 cogs. That's going to be our leitmotif for the rest of the session. So what we've got there is that big cog at the bottom. We need better information. We've got lots of information out there, but we need better information. The second cog, we need better coordination. Yes, there's lots of coordination out there, lots of systems, but we need to improve it. And then the thing that drives and that we found for the preparedness of the ERNE program is that we need a common objective. Here we were trying to prevent and anticipate nutrition crises and work together. So this session is about how the health system and the early warning, early action system have their own individual cogs. They just spin and they report and they collect information. And our role was to try to get more touch points, get these cogs to meet and talk to each other so that our health actors and our disaster risk reduction or our disaster preparedness or our disaster manager teams could find reasons to talk to each other more often. So we're going to test a little poll here. So Moya's there and she's just popped a question on the screen, and there should be a poll facility. So out of those three cogs I've just mentioned, having a common objective, having better coordination and better information, when you're thinking about how to integrate our health and nutrition and early warning systems, why don't you rank these in order of feasibility for us, please? Thank you to our translators interpreters who are helping the Francophones read those questions. We'll just give you a few more seconds. Okay, Moya, I think we can share the results of that poll. Thank you. Right, are you all seeing that on your screen, or am I the only one that gets? Okay, so it looks like having a common objective, having better information or close tops with better coordination. So thank you everyone for participating in that. They're all needed. It's just a question of sequencing, timing, and getting the right information at the right place. So let me just delve a little bit further. The common objective we had in ERNE, as I said, was to increase preparedness and local capacity to respond to nutrition crises, and extend a little bit to the food insecurity shocks, which we know is one of the main drivers of malnutrition, but not the only one. Having better information flow between systems. So this is really about the data synergies, bringing that health and nutrition data and that early warning systems data together at the right time for decision making. And then the third one, the coordination, is about having more coordinated sequencing of actions. I mean, there's no doubt that the health system and the early warning system have a great range of actions, but it's about sequencing them. So now on this slide that you can see a little bit more detail about what we mean. And that's what we're going to spend the rest of the session on. We're going to delve into those subjects that have been put under each cog. Yeah, our teams will walk us through them with specific examples, so we can decipher together what we have learned and what we mean by these concepts. So I'm now going to hand over to our program manager in South Sudan. So Isatu will share with us an example of the better information cog, and that combines early warning system and health and nutrition system information, presenting the early warning risk matrix. So over to you, Isatu.
Thank you very much, Jackie. Good afternoon, everyone. Generally, as part of the program component, we have been trying to establish the early warning system in the pilot area in South Sudan. As you might have been familiar, so in South Sudan especially, the location where we have been implementing the ERNE program is categorized as the emergency setup. So any response or activity that we have been implementing is just responding crisis under the crisis itself. And in the middle of that situation where there is no strong early warning system, and when the situation is fragile like this, there have been still possibilities to identify different indicators related with climatological, hydrological, and socio-economic aspects like livelihood, market, and the population movement. These are the key areas: health, nutrition, and the coping capacities. These are indicators that we have established with the different thresholds and the trigger level to anticipate the likelihood of a given disaster in that location. So we tried to narrow down a number of indicators, and based on that, the health and the nutrition data is one of the very responsive indicator in conjunction with other indicators. We have been collecting, like on weekly basis, we have been collecting the incidents or the cases related with acute watery diarrhea, malaria, and related communicable diseases. These are very helpful. And in the case of nutrition data, we have been collecting under 5 morbidity and the number of admissions, the cumulative, as well as the weekly new admissions to the facility. And it helped us to understand the trend through time pattern of the number of people who have been or will be exposed to communicable disease and malnutrition through time. And collecting the same data for health and nutrition, that's also linked with the community-based risk monitoring that we have been collecting some qualitative data from the Disaster Management Committee, the Early Warning Committee, and grassroots level. And this information useful and helpful to understand and to gauge the effectiveness of the intervention even that we have. And through time, we identified and tried to anticipate the level of the status, the threshold, whenever there is a threshold level warranty for a kind of response, because this is now multi-sectoral type of risk monitoring by itself. So health and nutrition related data were used in conjunction with the other indicators that we indicated above. So in this case, in this targeted area, we managed to have at least that prediction and a response through a multi-purpose cache in selected areas that we have identified those risks. Yeah, this is what we have tried in Unity State, where the emergency situation is commonly happening throughout the year, but with some sort of disparity through months, because there are some harvesting period and a lean season. So this information was very helpful, and we try to incorporate it into the existing master risk monitoring tool. Thank you very much. I want to wind up my presentation here. Next, I'll hand you over to Alamayo from Ethiopia. Is cash and the market as well as early warning advisor. Thank you.
Thank you, Satu. I will talk about how we can make better use of the data collected by the system. So for Amhara and Somali regions of Ethiopia, we have created a joint health and nutrition and early warning, early action seasonal and event calendar. So now I'll be presenting the Amhara region joint seasonal calendar. So to prepare this calendar, we have gathered data on different indicators or factors, including temperature, malnutrition, market price, food security, or food production lag. So as you can see on the calendar, if you look at the this joint seasonal calendar, malnutrition is peaking on September and August, and that we need to get ready by taking surge actions, which includes like raising community awareness, empowering health facility staff, maintaining staff availability, mobilizing resource, and reporting to higher levels if, in fact, it exceeds the capacity of the facility or wherever. So now let's look at some of the underlying factors of this malnutrition. So let's start with the good caring practices. If you look on the seasonal calendar, the good care practice is put at high risk in July and August. So this causes morbidity to be at peaks, such as like diarrhea and acute respiratory infection cases, which are once more very much correlated with high malnutrition during the same months I've mentioned in July and August. So again, if we look another underlying factor, for instance, food security, such as staple crops are at peak in February, March, and April, while the production of vegetables and milk are peaks in September. So this tells us that As a result, morbidity and the malnutrition are at the lowest level during these similar months. So, if we look another factor, for instance, migration of labor for outward migration of labor for different agricultural practices, like for planting, weeding, harvesting, and like. So, during this period of the year, caring practices is usually compromised, and which consequently leads to the malnutrition. So, in conclusion, this joint seasonal calendar advises us to take better plan preparation as a part of an early warning. So far we have just shared two tools that improve information flows between the health and early warning system, and a multi-hazard risk matrix that Isatu and I presented. And it includes like health and nutrition information in the seasonal event calendar. So let's look at our framework again. So with this, I will be handovering to Jackie. Thank you.
Thank you very much, Isatu and Alimayu. So let me take you back to our COG diagram here. Yeah, we've just had the two examples of the better information and the two systems, trying to join them. Very simple tools, not time consuming, but they do need dedicated staff time. And we already discussed this morning in some of the sessions how limited health staff's time is. So it does mean carving out spaces for these joint tools to be worked on together, to be owned by the different actors in the different systems. And now let us go to the better coordination COG. We will hear from our colleague in Niger and look at the communication angle and then the sequencing actions angle as well. So I'd like to hand over to Julia now, please.
Thanks, Jackie, and good afternoon, everyone. So the ERNE program in Niger gave us the opportunity to capitalize on nutrition that we had in country, and it allowed us to reinforce the integration between the two sectors. In particular, we decided to hold a monthly meeting in order to strengthen the integrated monitor and analysis of data that were already collected as part of our routine monitoring of the program. And in order to do so, a tool was also set up to guide the discussion, as you can see in the screen. So some questions were asked on a monthly basis to our food and security and nutrition team in order to better analyze the situation in country, but especially in our program areas, and better look at data such as market prices or market behaviors, as well as indicators on food security, such as the livelihood coping strategies, as well as health and nutrition data. And based on the analysis, we were also comparing the month of analysis with the same month of last year, so of the previous year, just to better understand what was going on and if the situation could be considered normal for that time of the year, or whether something abnormal was happening. We were also looking at interventions from other actors, such as the government or other humanitarian partners. And based on those, we've been trying to understand what was the impact of the situation and of what were the data telling us, basically, on the potential impact on the household food security and nutrition. So at the end of the discussion, the analysis brought us to take an action that you can see on the right side of the screen, and basically is either we would carry on monitoring what we were regularly doing, so the regular data collection and field observation, or instead activate a response according to our early warning system. And that was a very useful experience for the Niger team, and we decided to share this at a learning event, a global learning event. So we shared the experience with other countries that also decided to take up this approach and use the same tool that we were using. And so beside internal coordination, it is also important to focus on external coordination. and especially on strengthening external coordination among key community stakeholders. And in Niger, the surge approach in particular gave us the opportunity, as it was a framework that allowed us to reinforce coordination and to engage the stakeholders and to mobilize resources for the health system at community level. So in the next video, you will see the Secretary General of the Commune of Tajaye, Abdoulaye Jibril, who will highlight the benefits of the surge approach for his commune, highlighting in particular how it allowed them to anticipate solutions and better solve problems in their community. So let's have a look at the video.
Je réponds au nom d'Abdoulaye Jibril Abousseni, le secrétaire général de la commune rurale de Tajaye. Je vais dire l'objectif même de l'approche. Donc c'est une approche qui permet d'augmenter la résilience du système de santé, donc afin qu'il soit capable de fournir des services de qualité pour la prise en charge surtout de la malnutrition aiguë. Donc à 2h30, quand l'approche nous a été présentée en tant que représentant de la commune, donc nous avions à bras ouverts accepté cette approche-là. Donc c'est vrai qu'elle a surtout pour objectif de prévenir, certaines situations qui sont évaluées selon des seuils. C'est une approche donc importante. Et elle est importante en ce sens qu'elle nous a vraiment permis surtout de gérer certains problèmes. Je vous donne un exemple. Donc, tout récemment, on a eu une situation, l'ambulance du CSU de Tajaye est tombée en panne. Il y a eu une insuffisance des moyens, donc on a utilisé la même méthode pour appeler nos ressortissants qui sont des autres contrées du pays à intervenir pour résoudre ces problèmes-là. Et un ressortissant a pris l'engagement, il a réparé cette ambulance-là. Et au niveau du CSI Chafa, Zourari Chafa, les communautés elles-mêmes ont contribué en dotant sur le CSI en matériel, surtout les chaises et une salle d'observation. Et tout ça, là, ça a été déjà programmé avec les rencontres qu'on a eu à faire. Donc les besoins ont été identifiés, une planification a été faite, et tout en se basant sur l'approche surge. On a pris des engagements qui seront surtout exécutés au cas où le seuil est atteint. Et ces engagements-là, on les a pris en tenant compte de nos planifications et en tenant compte de nos ressources. Dans les budgets, nous avons prévu une somme, donc il devrait être alloué à la nutrition, à la sensibilisation et au transport des entrants. Et dans les pays à plan d'investissement annuel aussi de la commune, à part l'appui des partenaires, la commune aussi a pris son engagement pour appuyer le secteur de la santé. Et vraiment, je salue beaucoup cette initiative parce que ça nous a réveillés, ça nous a permis surtout de comprendre qu'il faut prévoir d'avance des solutions et il faut prévoir des solutions après l'identification des problèmes. Il y a un problème qui est là, donc comment le gérer? Donc c'est ça en fait l'objectif même moi, d'après notre compréhension de l'approche. Et c'est une approche également du plaidoyer, on a fait les plans d'action, d'appeler d'autres partenaires, de leur présenter cette approche-là pour qu'ils puissent comprendre qu'elle est une approche estimable, surtout dans le secteur de la santé. Et pour finir, donc, je salue surtout, j'encourage le concert, le partenaire qui nous a présenté cette initiative-là. Nous allons faire tout notre possible pour que ça soit périn. Ça devrait même dépasser le niveau communal, le secteur de la santé. Moi, je pense que tous les secteurs devront avoir cette approche pour résoudre les problèmes auxquels ils font face. Merci beaucoup.
So, having heard from our Secretary General, Abdoulaye Djibri from Tajaye Commune, we would like now to hear your opinion. So I'll hand over to Jackie.
Thank you, Julia. And thank you to all of you. Hopefully you hearing it directly from our partners on the ground for us definitely makes it more real. Promoting an approach, you might have heard, you know, our colleague mentioned that this is a worthy approach. So we definitely agree that that's what's needed for them to promote it. So here we have our second poll. It's an easy one. I mean, our colleague, Mr. Abdoulaye, he's suggesting that more sectors should be using this approach, should be investing in preparedness. So here's a simple poll for you. Do you agree, disagree with that statement? And if you would submit your answers now, that would be great. Okay, Moya, maybe you can share the results of that easy poll with us. Oh my goodness, this is what we were after, 100% agreement. All sectors should be investing in more preparedness. And as straightforward as that sounds, even ERNE, with a specific result dedicated to preparedness, we found a large chunk of our financial resources and a large chunk of our human resources were devoted to classic emergency response. We've already mentioned the deteriorating context that we had to operate in, the life-saving objective under our first pillar. And it is very, very difficult to carve out human resource time to carry on with the preparedness work. So when we say that more investment is needed, it sounds easy, but to actually keep on doing it when the context calls for rapid responses and emergency actions makes it extremely difficult. And therefore it requires a huge group effort to protect the preparedness activities. But thank you everyone for taking part in that poll, and thank you, Julia, for the explanation of the internal and external communication and coordination systems that you've set up so successfully in Niger. We've now got our fourth presenter. I'll hand over to Alex Krakovic. She's our ERNE monitoring and evaluation advisor. She presented herself earlier, and we're going to hear an example of better coordination in terms of improved sequencing of actions. We're going to stay on in Niger for this example. Thank you, Alex.
Hi again, everyone. Hope you can hear me okay. So yeah, thank you very much, Jackie. Indeed, I'm going to speak now about the better coordination aspect of improved anticipation skills, and we'll focus on the sequencing actions element using the example of responses that we've implemented in Niger in year 2 and year 3 of the ERNE program. And what we will follow here is the evolution of household food security status measured by food consumption score and reduced coping strategy index. And we will follow in particular 2 cohorts. So we will follow first the cohort 1, which is the early action, which started in April before the lean season, and also cohort 2, a rapid response, which started with the beginning of the lean season. And in Niger, lean season corresponds with the period stretching from about June to September. And this comparison in general is really interesting for a number of reasons, especially given the seasonal nature of food insecurity in Niger. Simply put, it's likely to repeat itself, and therefore it's a lesson we can carry into the future. What I also wanted to mention is that, and very importantly, we will be, sorry, it's a little bit too fast now. We will also follow the cohorts subsequently being monitored into the end of the lean season, so until the September of 22. Plus, we've measured what we have called the midterm impact check-in, so in the month of January, the following year in January 23. And before we jump into looking at the food consumption scores for both cohorts, maybe I just wanted to add a little bit more on the background, the detail. So the presented results are coming from early action and rapid response, which were implemented by Concern in response to failed harvest and food insecurity in the region of Tawa, and specifically in the departments of Ilela and Tawa in case of early action with about 1,100 households, and in the departments of Buza and Ilela in case of rapid response with about 1,400 households included. And the monitoring was done using the standard PDMs, which were collected about 2 weeks each time after the distribution. And those PDMs, apart from other questions, included, as per our ERNE log frame, 2 widely recognized food security indicators, so the food consumption score and the reduced coping strategy index. Now, before we look at the food consumption score results, I just probably should give a quick reminder of what food consumption score is and how to read it. So very quickly, it is a proxy indicator of household food security status, and it measures the frequency of consumption of different food groups which are consumed by a household during the 7 days before the survey. And for the analysis, the final score is categorized into 3 groups using standard fixed cutoffs. So we have the green, which means acceptable food consumption score, amber, which means borderline food consumption score, and red, which means poor. And as perhaps you all know, or if not, it's just even very intuitively, the more people find themselves in the acceptable category, the better. And also the early action in general, what we're trying to do is to anticipate the deterioration of the household food security situation, and so simply aim to prevent more people finding themselves in the red, so poor category. So, like I said, we monitor the cohorts all the way until harvest, and post-harvest, you will see that in a second. So when we look at the cohort 1, so the cohort early action, what we can see is that at baseline, we have around 66% of respondents which are already in the borderline category. However, very few actually are finding themselves in the poor categories, only 3%. And as we continue with the support until the end of the response, so until October, until the end line, the situation is improving, so improves and stabilizes post-harvest. And we see also that the results are being maintained. Now looking at the results for the rapid response. So as you can see in the graph at baseline, collected in June, so as per design, because we are starting at the beginning of the lean season with the rapid response. What we can already see is quite striking, is the elevated percentage of poor category, so it's almost 40%. And later, the repartition of the scores as we continue with the rapid response, again, improves and stabilizes at the end of the lean season and into the post-harvest. Now, what I really wanted to bring your attention to here is the beginning of the lean season, since this is perhaps for us the most important learning in here and lesson we're able to draw from the sequencing example. Because what we can see is that anticipating and triggering the support before the lean season started allowed us in this case to prevent over 30% of the household population to fall into food insecurity. So in other words, like concerns early action through the cash transfers and in kind, in this case it was food support, protected household food security pre-lean season. And also, what is important to highlight is tying that to the coordination aspect. In this example, we need to remember that 2022 is a crisis year in Niger due to failed harvest, which then consequently increased the price of staple foods beyond the reach of large populations during the lean season, and that called for coordinated emergency support. And so having this information at the beginning of the year allowed for timely identification of the need both trigger the early action and to sequence the early action with additional support to the households to see them also through the lean season. And we can see in the example that these households, so the early action households, also recovered more quickly post-harvest in comparison to those households which only received emergency support during the 3 months of the lean season exclusively. And one more point that I've noted for myself is not to also forget that perhaps there's also a lesson in here for us to related to the minimum number of distribution rounds that are perhaps required to both prevent the food insecurity from occurring and also to speed up the post-lean season recovery and subsequently make a more lasting impact on the household food security. Now, the interpretation of the food consumption score actually is converging also with the interpretation of the second indicator that we mentioned earlier, so the reduced coping strategy index. So I just wanted to, again, give a quick reminder of what RCSI is and how it works, just to be clear and on the same page how to look at the graphs. So RCSI measures household food security or insecurity by assessing the frequency of strategies that people apply when they cannot access enough food. And so each of the standard strategies in the case of RCSI is weighted in a standard way across all countries. It's the same tool that you would use in any country. And when it comes to the interpretation, the higher the score, you will see in the graphs that the higher the trend, the worse the food security situation, because either more strategies are applied and or the higher the severity, because they're weighted, as mentioned before, of the strategies that are being used. So we will now have a quick look at the results for cohort 1 and cohort 2, following the same logic that we've just used to interpret the food consumption score. And the second, perfect. So we can see in those graphs that just like with the food consumption score, when looking at the RCSI results, the food security situation at the start of the lean season, so in April, for the cohort of households which started to receive support only at the beginning of the lean season, those households are actually in a far worse position. So you can see the RCSI score is about 3 times higher when comparing with the cohort 1, which started to receive the support earlier, so already in April. Again, same focus in here at the beginning of the lean season. We can see that there is a big difference between the 2 cohorts. And those cohorts, the cohort that started to receive the support in April was part of anticipatory, keyword in here in the session, or what we would call in ERNE terminology as part of the early action. And I think that's all from my side, and I hope you found this illustration of this improved skills for anticipatory action with this better sequencing and better coordination focus, at least a little bit thought-provoking and interesting, and I'm looking forward to the discussion. I'd also want to thank our MEO team in Tawa, and in particular CD, our MEO officer there who extracted this from our databases. And on that note, I think I'll hand over to Jackie. Thank you.
Thank you, Alex, for those candid reflections. And as you can see, that this example through the Niger responds to the seasonal food crisis in a year where a third of the population had crossed the IPC3 threshold. We've called it sequencing action. So you've been given a clear example of early action, before the peak of the hungry season, also following the hungry season for the pastoralists as well as the agriculturalists, which have different timelines, and the indicators we've used. Lucy and I would like to take this tool further, and we would like to be able to include and analyze the number of health facilities that over the same timeline, so when we started our early actions in February, March, right through to the end of the harvest season when we know food supplies are available again, and see how many of the health facilities in the same geographical area have crossed the surge thresholds. So the tool can be strengthened even further by starting to sequence our different sector actions and get a better analysis. So thank you to all the speakers for presenting our examples. We will now sort of wrap up the session a little bit, reminding you of our little cog here. The session was about better preparedness. And our key message to you is it really is about better anticipation skills. You heard in the morning in the health and nutrition sessions, we know what happens when there's a plumpy nut stock out. You know, we know what happens when the health facilities are not well staffed and there's not enough human resource capacity. But we're focusing on the anticipation skills aspect of preparedness, not to underestimate the knowledge, the reading of the context that seems quite common sense to the people who are working it on a daily basis, but having the analysis tools to use the anticipation to predict better and then to line up the information and get those touch points with the other sectors. So we would like to leave you with these two key messages, that coordinating our analysis and using that seasonal information to better understand the drivers of malnutrition needs to be followed up with much stronger localized early action plans. Often our health facilities, our disaster risk committees are in very remote locations, difficult to access. And those central policies that are devised at national level find it very difficult to roll out. And communities cannot wait for external action. They need to be in control, need to be able to analyze their context and have the means by which they can act according to the crises that's surrounding them. So we'd like to say that localized early action plans where the sector responses can be sequenced and known by everyone would be a great way of strengthening the capacity to be prepared for these crises. And those are our key messages. So Lucy and I would now like to invite all our speakers on today's call to put their cameras on, and we'll open the floor to any questions and answers. We've seen a couple in the chats, not that many. So if you need a bit of time to think, please add any questions in the chat. For now, I think we've seen 2 clear questions. Lucy, what? Shall we start with the first one there?
Yeah, I think we can start with the first one. So the first question is in relation to why we didn't include indicators related to capacity of health facilities in the early warning assessment. So a really interesting reflection and very much linked on the surge approach. And so perhaps I can speak to what we mean by capacity when we're talking about the surge approach, and then Jackie might be able to come in on that. So when we are setting up the surge approach, understanding the capacity of a health facility is one of the most important things to do, looking through the different building blocks and seeing how many staff are available at a health facility level, what access to supplies and resources they do have, what is their catchment area like, and what are the facilities in which they are working in, what do they look like. And this morning we saw through Kate's presentation the health facility assessment tool and how that was used, giving us an even better understanding of the health facilities in which we are working in. So that's what we mean when we are thinking about the capacity of health facilities. How this would be then integrated into an early warning assessment, I think Jackie might be able to speak to that a little bit, but it's definitely something that is a really important reflection when we are trying to find these touch points between the 2 approaches. Jackie, if you want to take over.
Thanks. We have to be very frank here. Using a multi-hazard early warning system has proved to be tricky. You know, getting the health and nutrition data included as part of the routine early warning system monitoring has not been as easy as we made it sound, perhaps when we presented it. You know, the health system has their linear reporting, they've got their triggers, they know exactly what to do if there's a cholera outbreak, and the disaster risk committees at community level, they know what happens if there's a hailstorm that puts their livestock health at risk or that destroys crops. So the capacity of health facilities, I think, needs to be rolled out as a concept more often and be seen to be something that the health administrative area, the coverage area can manage and promote more often. We weren't able to include that. We think it's a great idea. It might be tricky in some of our operational areas because of the staff rotation and the lack of supplies, but definitely for us to keep on the radar, to keep on improving as we do this in the future. But thank you for your question. I see there's a question on cash. Shall we do that one? So Paul Binns has asked a question on the Niger example with the early action and the rapid response through the hungry season. It appears to have reduced household food insecurity. Did it also have an impact on the admission trends for acute malnutrition? Paul, this is the question we've asked ourselves. And although we did ERNE for 3 years, and Niger was one of the countries that already had these seasonal cash responses and already had the nutrition, the CMAM, and the surge capacity, we weren't able to overlay that data. It takes a full calendar year for the seasons to play out and for us to collect the data. But that's exactly the point that we're at now. We would like to be able to overlay those and then allow the different people in each system to understand the links. What we have seen using the multi-risk hazard assessment is that the whole national and humanitarian setup is very much set up for household food insecurity and for shocks, events that cause displacement, or these dry spells that turn into a drought, or these flood events. And the early warning systems in all the countries we've worked are not very well set up for the cumulative impacts of the drivers of malnutrition. So even if you have a case of malnourished children going up, that is going to be, in what we've seen so far, very unlikely to trigger an external response. Increase in malnutrition levels at health facility level doesn't seem to be a powerful trigger for doing a humanitarian response beyond the health system, unlike an increase in the price of staple foods or a dry spell that's gone beyond the 10 days or the 12 days that's expected. So unfortunately, we haven't found that they're good triggers, but as mentioned earlier, we would like to overlay that data and think your question is highly relevant.
So there's another really interesting question in the chat box from Fiona, I think, about the ownership of the information for early warning systems and where this sits and who has responsibility for this information. And so when collecting health data and contextual information such as rainfall, population displacement, would this imply that the ownership sits beyond the community level? Or perhaps you might comment on ownership issues where there is a good practice. So I was thinking that perhaps one of our country team members might be able to speak to that point. And perhaps, Isatu, would you be able to start, if you have any reflection on the ownership of this information?
Okay, thank you very much. As far as the ownership of the data collection process in the system is concerned, it is a very paramount importance. Like, for example, in our case, at community level, we have disaster management committee, and just at the last mile level, the early warning committee members who have been regularly collecting qualitative information at community level, and they are connected with implementing partners, especially with us. In the areas where we have a strong early warning system in a very responsive way, it is mostly like in countries like Ethiopia and Niger. It is a government system that has been already established, and the ownership is in the hands of those responsible bodies, and our contribution was also great. And in our situation, like in a fragile context like South Sudan, the information, the data gathering process is centrally coordinated by the responsible humanitarian organization, because contextually, this country, we have some sort of gross areas from the government side to manage all the humanitarian responses and the related interventions. Thank you.
Thanks, Isatu. Yeah, so exactly that government ownership of the data. And you even mentioned Niger, and that was next on my mind to see if Julie had anything complementary to add to that from her experience in Niger.
Thanks, Lucy. Yeah, definitely. We have an existing early warning system in country, so the ownership of the information is on their side, and it's present at village level, at commune level, at department level, going up to the regional and national level. So definitely it's there, but what I think is still challenging is to improve the quality and availability of health and nutrition data, especially at commune level. And this is what we've been observing through the program, and this is what we've been trying to support. And I think the link that we've been discussing about early warning, early action, and search all through this last hour is really key about improving, having better information and improving also coordination between these sectors. So yeah, it's been going on since several years. But I think that the program gave us an opportunity to reflect and engage with the community, so to better coordinate in that sense.
Thank you, Julia. I'm going to add a third example from Sudan, even though none of our Sudan country team are presenting today. But Sudan, like South Sudan, was one of those countries where we set up the early warning system at community level from scratch as a pilot. And it meant galvanizing the different representatives of the different authorities, line ministries, and the HAC authorities, and galvanizing them to find out what information are you collecting that's your information that you would like to put into the system. So in a sense, starting from scratch gave us a different approach, because it allowed us to say, this is the information you have, how shall we use it, how shall we trigger it? A very different starting point. And it takes years for that then to turn into a national system like the ones we can see operating at Ethiopia or Niger level. They've got very, very staggered early warning systems. But the information is one thing. My key message, Fiona, is it's also about the triggering. What does that information actually lead? What type of action does it lead to? So it's down to the decision making, and that definitely has to be local ownership. Otherwise, the actions will not be done.
So do I see another question in the chat box? We're nearly at time. So I see Regina has just put in a question. At the very early times of CMAM surge in Kenya, data collection for situation monitoring was done manually on flip paper. And to see that it is now done more professionally, to what extent has the professionalism helped or hindered data quality and ownership? So a very interesting question. I can perhaps speak to that a little bit. I would ideally like to pass to Mariama, but I don't know if she is on the call with us right now. But I think the key thing that we try to continue to promote when we are making sure to use that data manually is to keep it at the health facility level. Despite perhaps the system being a little bit more formalized, we still are ensuring that the tracking of morbidities is happening at a health facility level, and that they are tracking that on flip chart paper and really interacting with the data. Because I think if we digitalize it too much, sometimes the interpretation and understanding of the data is lost. And I think that's what we've really seen today, is that the closer you can interact with the data, the more likely you are to understand it and then see where we can perhaps share that information. And hopefully tomorrow we might have a chance to touch a little bit more on those changes that we have been reflecting on with the transition to the surge approach. So at that, I think I will wrap up the session. We thank you all very much for joining, and in particular to our country colleagues who have been able to join us despite the internet connection in different locations. And yeah, I think I'll pass back to you now, Conal.